the response to Mpox in the African region has already very much been ongoing. So both in countries that are actively affected as well as in countries that are at risk, the World Health Organization has been working with ministries of health and member states, as well as coordinating partners to be sure that we're already actively responding to this particular problem. The declaration of a public health emergency of international concern that was made by Director General Tedros earlier this evening really serves as a call to action to the global community, which can have a lot of positive consequences for our ability to effectively respond to the crisis at hand. So, in addition to all of the work that was already ongoing, what this means is that we can work with the international community to make sure that we have the resources available to respond. But in addition to that, it means that, as we are already doing, we can work under what are called the international health regulations within the emergency response framework to really make sure that we're effectively coordinating the response. So we're going to be doubling down on our efforts, bringing in those additional resources, and making sure that we can bolster the work that we're already doing.
What are the recommendations to address an Mpox in general, particularly this new form of Mpox that seems more virulent?
There actually is a treatment available, tecovirimat, and the World Health Organization has been supporting countries in the African region, for example, South Africa, to be sure that they're able to access doses of this very novel therapeutic to be sure that people are able to get the clinical care that they need. And this is a very difficult process, and it's the same process that is true for vaccination, which is that really one of the barriers is a regulatory one. We have to work country by country to be sure that countries are able to import and then put to use something like the therapeutic that's available, or in the future, the vaccinations that we may be able to roll out. We have worked with, for example, the Democratic Republic of the Congo with their national regulatory authorities and their Ministry of Health to be able to bring vaccines and to come up with a vaccination plan that hopefully in quite the near future, in the coming weeks or a couple of months, they'll be able to begin targeted vaccinations within the country. Dr. Tedros last week, independent of the PHEIC declaration, initiated what's called an emergency use listing procedure for 2 different Mpox vaccines. That process will take a little bit of time, but once it is concluded, provided that the vaccines are assessed to be viable, there will then be the opportunity to really more significantly roll out vaccines to interested countries. And so what we'll be doing in the meantime is working with risk communication, community engagement, and also that regulatory component that I've already discussed to be sure that once vaccines do become accessible, that we're in a position to hit the ground running and roll them out to the people that need them.
Speaking of contact tracing, do we have a clear understanding as to who patient 0 is, where it's coming from, and also the way by which the outbreak is spreading across borders?
With Mpox, that's not something that we are able to identify for most of the outbreak that we're focusing on at the moment. This is because Mpox has really been endemic for quite a long time in parts of Africa, especially in Central Africa and also in West Africa. Sometimes, depending on the country or specific outbreak we're talking about, it is possible to identify a patient from whom we think the first case was communicated from what we call the animal reservoir. In the case of the outbreak in the Democratic Republic of the Congo at this moment in time, however, really we're talking about cases that are being communicated between one person and another person. And so at this point, the concern is really about making sure that we can provide those people the support and the prevention as well, and the risk communication and community engagement they need to try to prevent that transmission from continuing. As the WHO ourselves and under the international health regulations and our emergency response framework, we work very, very hard to be sure that we're in a position to support coordination between all partners, including the Africa CDC, but also including other UN agencies such as UNICEF and other INGOs and the like, to be able to ensure there's a harmonized, synergistic, and coherent response, coordinated response to this particular crisis at hand.